This is the WGNS Action Line, talking with Rutherford County newsmakers about what matters most to you. Now, your host, Scott Walker.
Today in studio, we have as our guest a doctor from St. Thomas, Rutherford, Dr. Robert Mildenhall. So Lung Cancer Awareness Month. What are some of the things you're doing to better educate the population?
Thanks for having me on. November is Lung Cancer Awareness Month. What we are trying to get our community and just, even from a national and worldwide perspective is, lung cancer is the leading cause of death, not just, in the U.S., but also in the world. And I think we sometimes forget that there are things that we can do to reduce that risk. And so that's why I'm here today to talk about some of those things.
Does lung cancer hit both men and women equally, or one more so than the other?
So it's more predominant in males, but it's the female population's not far behind. So it's pretty close.
And what are some of the leading causes of lung cancer today?
Smoking is probably the most common cause of lung cancer as far as risk factors go, but there also is a subset population of non-smokers who actually get lung cancer. It's close to the 20% range in adenocarcinoma, which is the most common cause of lung cancer.
Have there been any changes over the years as far as the age groups that usually get lung cancer?
Right now, as far as what we are doing to try to reduce the number of cancer cases, or at least catching them early, is the key thing. We are targeting a population between the ages of 50 and 80, people who have a 20-year history of smoking. And we are trying to capture catching this early by doing screening through CT scans, which is a low-dose CT scan, which can be ordered by your primary care physician.
Again, with us today, Dr. Robert Mildenhall from Ascension St. Thomas, Rutherford, here in Murfreesboro. When you look at the population locally in Rutherford County, do we have higher numbers than other communities?
As far as, I'll say from a national perspective, Tennessee is in the top 10 as far as number of states in lung cancer and lung cancer-related deaths. And as far as Murfreesboro, this Middle Tennessee area, we have a high number of cases of lung nodules, which is one of the first early detection factors that, we look at through CT scans and potentially leading to biopsy. So there's a lot of undiagnosed people in the community and may not even be aware that they may have it.
So when you look at other conditions within the lungs, histoplasmosis, are there other things that cause lung cancer that folks need to be aware of if they've had it before?
Really just it's a genetic predisposition, and then smoking are the highest risk. But to your point, there is a high rate of histoplasmosis in this area, and they can cause some of these lung nodules to come up on our CT screening. And so that's why it's important, one, to get it done, to get the screening done, and two, we have a service that we provide here from the St. Thomas Rutherford community, where we can look into these spots that may come up on a lung to say, are we concerned? Are these potentially benign, or do we need to be concerned about lung cancer?
So what are some other things that do cause these nodules on the lungs?
Most common causes are infection, inflammation, and an old area of pneumonia that may have scarred. But, to your point, speaking on the histoplasmosis, it can cause what's called a granuloma. And it can have some features that can be concerning on the CT images, but that's sort of the first initial workup. Where is our level of concern? And so we just need to make sure that we're evaluating those nodules.
When you look at other cancers that people are diagnosed with, one of the words you often hear is we need, to do a biopsy. And biopsy is one of those things that I think a lot of people fear because they don't really know a lot about it if they've never had cancer before or they've never had anything that was suspect. What does that entail as far as the lungs go?
Yeah, so to your point, we do colonoscopy screening for colon cancer. There's mammograms for screening for breast cancer. And so the amount of people who are aware of low-dose CT scans for screening for lung cancer, I think we could improve on. And again, the key thing is trying to detect it early, because the earlier stages lead to higher survival rates and sometimes even curative. And so when we talk about doing biopsies, that's one of the things that I do from a pulmonary perspective is we see a spot. It could be, again, low concern or high concern. And when we are concerned, we offer non-invasive ways to biopsy these spots to get an answer. Is this cancer? Or is this benign? Because a high number of nodules are benign, but we have to biopsy them to determine if it is or not.
I guess a lot of cancers were discovered years and years and years ago, but newer treatments that actually had a meaningful impact on somebody's life didn't come around until, some of them, not until the 2000s.
Mm-hmm. The older approach used to be if you saw a spot concerning you, would just go ahead and cut that area out with the pretty major surgery and you lose a portion of your lung. So we've come a long way in how we can get access to biopsy these spots, very tiny lesions, even under a centimeter in size. So we have pretty advanced bronchoscopy where we use a lot of advanced technology to create very accurate airways and maps that we utilize to biopsy these spots. Because if you catch them early, it's going to be a higher rate of success as far as potentially curative resection. But yes, there's obviously chemotherapy, radiation therapy too, more advanced stages. But we have found that doing the screening through CT catches cancer earlier, and people have a higher rate of potentially curative resection, but also an increased 1 to 5 year prognosis.
Are there any other types of cancer that routinely go along with the detection of lung cancer that, maybe you see also this in patients, whatever that may be?
Yeah. I mean, any sort of smoking related cancers, obviously you're going to put yourself at risk for, aside from lung cancer. But typically, if we're going to find something, it's not the good thing we want to find, which is metastasis, where the cancer may have spread. So that's why we want to try to catch it early to prevent advanced stages and metastasis or spreading of the cancer.
And are there any other causes of lung cancer in the South that maybe you see more so here than other places of the country?
Probably more just occupational. So if you had high radiation exposure, but I mean, like I said, predominantly here in the Southeast, Tennessee, U.S., it's going to be tobacco use.
I know for years we used to see a lot of commercials on TV for asbestos and different cancers you can get with asbestos, breathing that in. Is lung cancer one of those? Yeah, so
mesothelioma, that is that asbestos-related cancer that you're speaking of. And sure, we still see that. I think as time has gone on and we're aware of the damaging effects mesothelioma can do, we're seeing less of it. But yes, it is definitely a concern as far as any lung cancers related with asbestos exposure.
Not too long ago, a lot of the homes that contractors would go in and renovate had asbestos in them, and commercial buildings too.
Yeah. Yeah, and we will see asbestos-related disease and mesothelioma. The good news is because of the awareness and educating people about protecting themselves if they're working around it, that number has gone down. Right now, we're seeing an increase more so, and adenocarcinoma is the most common lung cancer that we see, but just all lung cancers together. That's why, again, we're out here educating about doing the screening.
So kind of walk us through what occurs with a patient who comes to you and says, I've been experiencing, X, Y, Z, and kind of fill in that blank as to what people come to you saying, this is the reason why I came to you and I'm concerned.
Yeah. What I'll say is when they are nodules that are around a centimeter, even 2 centimeters or less, they're not going to be symptomatic a lot of times because it's too small to cause symptoms. When they come in with symptoms, whether it's persistent cough, coughing up blood, unintentional weight loss, that's typically a sign that the cancer is advanced to a higher stage, and that's the concerning thing from our perspective. So when the spots are small enough, you're not going to necessarily have symptoms, which is again pushing the importance of doing the screening so you can catch it early. Because when they're that small, you're just not going to have symptoms typically.
I think that coughing up blood, that's one of the most scary symptoms that somebody could have right off the bat. And it almost became known in movies. I mean, that's where you used to see that, a movie about somebody who had cancer or something along those lines. But that really happens. So when somebody coughs up blood, is it a lot of blood, or what should they look for?
Typically, it's not going to be a large amount like you're filling up, multiple cups. It's usually, comes up with phlegm, and then you'll see some, dark red blood, and, gets on a tissue, and then it kind of lingers, and it persists and increases over time. And again, even if you're having just a little bit of blood you're coughing up, you need to go to at least your primary care where they can refer you to a pulmonologist like myself.
And then what are the treatment rates, the survival rates of lung cancer?
It depends on what type of cancer. So small cell is a very aggressive cancer, and it's looked at a little differently than what we call the non-small cell cancer. So, depending on stage 2 also tells you what sort of survival rate or prognosis is with your diagnosis. So, the more advanced stage or the metastatic stages have lower survival rates in general. If we are able to capture the lung cancer early on, like in a stage 1, which is the earliest stage, and you're a surgical candidate, it could be curative. So it really just depends on what type of cancer you have and what stage. But definitely, again, survival and your prognosis is improved when you start seeing that the CT screening is used for lung cancer detection.
I'm curious, what are some of the youngest patients you have seen with a diagnosis of lung cancer, and what was their reasoning behind actually getting lung cancer?
I would probably say since I've been practicing, unfortunately, I saw someone in their early 30s with small cell that was advanced, and they just came in symptomatic, like I said, where they were coughing up blood and chest pain. That's a rare occurrence because, that was a situation of smoking, and then also just a genetic predisposition. They had multiple family members who had cancer at a young age. But typically we're going to see patients, and that's why they started the screening around 50 to 80, because we're typically seeing patients within that age range that are getting diagnosed around that time. So it can happen earlier. It's just more rare.
Lung transplants, is that something that still occurs? Is that something that you still do in today's times?
Yeah, lung transplants are still a method of treatment, but typically those are patients with lung-related diseases like pulmonary fibrosis or other chronic diseases that are irreversible. We aren't using lung transplants with patients who have a history of cancer, but it is still a treatment used on a particular subset of patients. Vanderbilt is the closest, lung transplant center, but there are multiple lung transplant centers nationally.
So here locally, what are some of the different levels of cancer treatment that you do here in Murfreesboro, where you don't have to go to Nashville for something?
Yeah, we have a pretty advanced cancer treatment team here in Rutherford, where you really don't need to go to Nashville you can get the same care here, which is nice. We have all the, Tennessee Oncology, our group here at Rutherford treats many of our patients who get different stages of cancer. We have radiation therapy here. They do an excellent job. As far as the sort of workup and getting the diagnosis, we have all the same technologies at our Nashville hospital. So and then again, and if you are a candidate for a surgical resection, we have a great thoracic surgeon who has a long history of doing many of these cases. So from beginning, as far as the screening to the biopsy, and then to the treatment, whether it's chemotherapy, radiation, or surgical resection, we have all that here with excellent providers.
So after you detect it, if you detect it at an early enough stage, what are some of the treatment plans that you have seen work very well on patients?
So if we catch it early, and again, if they're a surgical candidate, we have the resection is a curative treatment. For patients who can't tolerate surgery, there are options with radiation therapy that have excellent outcomes. And again, we have excellent radiation oncologists here. And then again, if it's a stage or a treatment that needs chemotherapy or a combination of either radiation therapy or surgery, we have excellent physicians to provide that here too.
So there are some forms of lung cancer where you literally go in, cut it out, and that could be the end of it?
Yeah, that's why we call it the curative resection. We're going to also, follow them along initially from after the surgery to make sure we don't see anything else that may come up of concern, but and we follow them closely, but it is a potentially curative treatment.
And how well do patients, recover from this? How do they feel after, week 2 or month 1?
That's like I was saying earlier, going straight to surgery before biopsy, like they did in the several years ago. It's not a small surgery. You have to go in and between the rib cage, and you have to spread that out and cut out a decent size of your lung, depending on what lobe it is. And then the recovery part is more for the healing from surgeries, and you're usually in the hospital at least couple of few days in recovery. And there is some pain and tenderness because it was a space that it's not usually used to getting that sort of stress. So eventually, though, people do feel a lot better as far as the pain and discomfort, and as long as they're in pretty decent health, they recover well, and they're they may notice some small things, but they tend to do very well. Are these folks able to eventually go back to their daily habits? Maybe it's walking every day, something like that, or are they out of breath? Yeah. So that's why we are careful about who's being selected for this type of surgery, because, you want to make sure that it's not going to cause a dramatic change in what we call their functional capacity, their ability to do their day-to-day routine. Because you are taking a portion of the lung out, it does affect your overall capacity, but we try to be very careful about selecting good candidates, so it's something that's not going to cause a dramatic change in what they do day to day. So, the population that we try to target are those who can tolerate the surgery and who aren't going to have severe limitations in what they do day to day following the surgery. So they should feel back to close to their normal selves.
Again, with us today, Dr. Robert Mildenhall. And if anybody listening would like to get a screening, what do they need to do first?
Your primary care physician can order these tests. Again, the target population is 50 to 80 years old, a smoking history 20 years, and within the past 15 years that you smoked. So as long as you check those boxes, talking with your primary care, or if you're seeing a pulmonologist, of course, we'll order one as well, and you go from there, just depending on what's found.
We're going to take a short break, check on the weather and the traffic, and then we'll come right back. Stay with us. We do have more news and information coming up.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Gift cards are always the easiest gift. This is Peter Demas at Demas's Restaurant. We will buy gift cards and just kind of have them on hand. They're amazing gifts to give to teachers. If you want to give a gift at your workout groups, you have a personal trainer, family members. It's great to give gifts for 16, 17, 18 years old who are just now beginning to date, and they need to be able to have some place to take someone on a date to. Gift cards are always the easiest gift. Demas's Restaurant on Northwest Broad Street.
We're excited to announce that Capstar Bank is now officially a division of Old National Bank. All those friends you've made while banking here over the years, well, they're still there. And so are the delicious, warm, homemade cookies.
In Murfreesboro at 2230 Dr. Martin Luther King Jr. Boulevard.
Everything you enjoyed at Capstar, still there at Old National Bank. Old National Bank, ready to serve you.
Old National Bank, member FDIC, equal housing lender.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Again in studio, Dr. Robert Mildenhall from St. Thomas Rutherford here in Murfreesboro. And as we close this morning, what got you interested in medicine and more specifically focusing on lung cancer?
That's a great question. I actually initially started my undergraduate as a business major, so I didn't have any intention of medicine initially. I think as I went through, I think accounting is what probably changed my mind on the business major. But I always had an interest in healthcare. Because I had some cardiac-related issues when I was a teenager, and so that sort of sparked interest. Obviously, I didn't become a cardiologist, but as I went through medical training, I had a strong interest for critical care, which I also do in my practice. And then the pulmonary component kind of grew on me as time went along, but I had a high interest in procedures, and advanced bronchoscopy became one of those passions over time. And I saw the great benefit of what I could do for a patient regarding diagnosing lung cancer early on and trying to help patients live a longer life, and also potentially, like we talked about earlier, maybe even getting a curative treatment.
So where did you first start in medicine as a doctor?
So I was at the University of Missouri for my medical training. That was a medicine and pediatric resident. And after I decided to do adult critical care, that was probably about halfway through my training. I moved over just to adult internal medicine and did a 3-year fellowship after my residency in pulmonary and critical care.
So again, if anybody is interested in learning more about lung cancer, or if they'd like to get tested in some way, that first step would be their primary care physician. Yeah.
Again, just making the self-assessment of your smoking history is a good place to start. And also, if you are currently smoking, of course, I'm going to push working towards quitting, which is not an easy thing. And I know that's hard for patients, but it can be done. I've seen people quit smoking in their 70s and 80s. So it's possible, no matter how long you've been doing it. So being aware that you're a potential risk of lung cancer is a first step, and then talking to your primary care physician about how you can get low-dose CT screening done. And
on the positive note, I'm sure you've seen a lot of people who they received the proper care and they were cured of that lung cancer.
Yeah. Again, it's not a small surgery, but in the bigger picture of things, curing what can be a deadly cancer, and like we said earlier, the deadliest in the world in the U.S. as far as causes of death from cancer, there's a lot of possible positive change that can occur.
Again, with us this morning, Dr. Robert Mildenhall, and again with Ascension St. Thomas Rutherford here in Murfreesboro. Thank you for joining us.
Thanks for having me. I appreciate it.
Stay with us. We do have more news coming up in just a minute, including an update from CBS Radio News.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Hi, this is Amanda from Animal City, and our hand-fed baby bird nursery is starting to fill up. If you are looking for your next sweet feathered companion, come in and see us. Find your next pre-loved, pre-spoiled pet here at Animal City. Be sure to check out our downstairs level. Here at Animal City, we would like to thank Murfreesboro for letting us be your family-owned and operated pet store for 33 years. Animal City is located at 919 Northwest Broad Street.